Yes, on the Zuma 1 study, there were about 25% of the patients who were above the age of 65. The oldest patient treated was 76 years old. And what they found on the subgroup analysis on the Zuma 1 study is the response rates and the durability of the responses in the elderly is comparable to the younger population. But what we don't know is the safety is also comparable in these two groups. So we looked at safety in the elderly patients with axicabtagene in patients treated at our institutions. We collected data on all patients who were treated at MD Anderson. There were a total of 72 patients treated over the last 3 years with axicabtagene. Of those, 20 of them were 65 years or older. And when we looked at safety outcomes in those patients who were above the age of 65, it was comparable to the below the age of 65, both with respect to the incidence and severity of the cytokine release syndrome, as well as the incidence and severity of the neurological toxicity. Moreover, the efficacy was also comparable. We found the median hospitalization period was also identical in both groups. It was 16 days in both groups. And the ICU admission rates was about a third of the patients required ICU admission in each group. And the median ICU admission number of days was 3 to 4 days. So it looks like overall, axicabtagene is fairly well tolerated in the elderly population above the age of 65, with the safety and efficacy outcomes comparable to the younger population.